WECB Headland, WJRL Slocum, WESP Dothan, and WBBK Blakely Dothan. Welcome to Wiregrass Strong, the Reboot, your weekly dose of local COVID-19 related information, brought to you as a public service of Knights Wrecker Service, with locations in Ashford, Headland, and Dothan. Call Knights Wrecker at 899-3257. Wiregrass Strong, the Reboot, is streaming live on Facebook at B1053 and on YouTube at Wiregrass Radio. Our phone lines are open at 699-1053, or you can chat with us live online. All right, welcome to Wiregrass Strong for a Wednesday. We're going to do it once a week because I think we were saturating the folk with information, Dave.
Yes, I tend to agree. Well, you know what, Ricky? Along with the governor, and I'm sure with the Alabama Department of Public Health, everybody is anxious to move forward, but safely.
Yeah.
And just like that, Wiregrass Strong needs to do the same thing, move forward in a safe way. We need to still bring the information, but maybe not quite as frequently.
Well, I've got the ear of all four of our radio stations. Let me pass this information along. This is from Jim Nunley. And be advised that the Houston County Sanitation will be picking up household garbage as usual on Monday, May 25th and Monday, June 1st. Although these are both county holidays, there will be no change in the sanitation schedule. So ensure that your trash receptacles are out by 6 a.m. on your normal trash day. You don't want to miss that. All right, let's get an update now on what's going on here in the state of Alabama. As of 9 o'clock this morning, the Alabama Department of Public Health confirmed 508 people statewide have died from COVID-19. There are 12,701 cases of coronavirus in Alabama, and there have been 162,000, almost 162.5 thousand total tests. In the last 14 days, 4,019 people have tested positive for COVID-19, and 61,615 tests have been reported to the state. And then the rest of this breaks it down by counties, but the state reports 1,492 people have been hospitalized since March 14th. So that is the latest information that we have, and we have that from the Alabama Department of Public Health. And speaking of which, the Southeastern District Administrator is here with us today. That is Corey Kirkland. Corey Kirkland from the Alabama Department of Public Health. Corey, so proud you could join us today. Thank you.
Yes, sir. Thank you for having me. It's a pleasure to be on.
Well, I guess that one of the first questions is, now that we think we are starting to have an effect on the coronavirus, testing is still one of the biggest things that people want to know about. Is there anything, Corey, you can tell us about testing or plans for more testing? I know that the Public Health Department sets them up in periodic locations. I don't know if those are antibody tests or the coronavirus test, but maybe you could speak to that.
Right now through May, we've been testing every Wednesday in Houston County. In fact, today we tested over 80 this afternoon between 1 and 4. So we've had a very successful day here. Each day, or each week, I should say, in Coffee County, we're doing Tuesdays and Thursdays, and we're seeing anywhere from 25 to 60 or so each time we test there. Trying to make that the goal was to make that a more consistent place, a more centralized place for the 10 counties that I am responsible for. Houston, of course, every week because of the largest population of the counties that I'm responsible for. And also just to help some of the providers to be able to have a resource to send patients to take some of the load off of them, reduces the likelihood that they've got to bring patients into the building for testing. So our drive-through clinics really have been very, very successful. I think the public has enjoyed the fact that they can come here. They don't have to get out of the car. We do all the paperwork basically through the window with them, and they get swabbed and they're on their way. And as soon as we get test results, actually my employees start to call them back, and we fax results to the doctor's offices ourselves, and make sure that that everyone's taken care of. So it's been very successful. I plan hopefully in June to maintain the same schedule with Houston and Coffee going forward. So again, to keep some consistency. We are going to have to consider the heat. South Alabama does warm up very quickly in this time of year. So we're probably going to look at morning drive-through clinics going forward. So we'll probably do something like a 7:30 to 10 or something like that, so that there's enough time for everyone to get through, and maybe some of those are still trying to get to work, or they need to be somewhere else, that they can come by earlier and get back home. Kind of help my employees not to get overheated, and still provide the service that we need to provide. So that's our plan going forward. We will still do other clinics if we're asked, if there's a need, if there's an outbreak at a facility or a small town or something like that. We'll still do those. In fact, tomorrow we're going to be in Coffee in the morning, and then we're going to run to Geneva due to some requests there from the local county administrators and different others there, the sheriff's office, for some additional testing. So we're going to do 2 tomorrow. So it'll be a busy day, and we'll continue to keep the same schedule for Coffee in Houston through June. And per request or per the need, we'll look at other facilities.
Just so we're clear, Corey, so that our listeners and myself, we understand, drive-up testing is still by appointment and as necessary. It's not just something anybody can just drive up and do, right?
Well, there are some in the state that are doing the appointments. We have decided not to do appointments. We thought that it was easier for the public to do that way. We've done as many as 103 hours, so we feel like we can push them through quick enough that it's not necessary. In fact,
Okay.
I think it might slow us down with appointments.
Okay. I just wanted to be clear on that, because a lot of people don't know. I was certainly not clear.
Sure. No, definitely. You do not need an appointment. We do have some parameters that we use to test by. In the beginning, that was basically just symptomatic. A lot of your hospitals were just doing that based on whether or not they needed to admit you. So if they needed to admit you, of course, they wanted to know whether or not you were positive with the COVID-19.
Mm-hmm.
We've expanded that testing. You can come if you're symptomatic, but if you are not symptomatic, but you have some sort of underlying health condition like heart disease, diabetes, hypertension, something along those lines, then you can still be tested without symptoms now. We're also testing healthcare workers still, anyone associated with nursing homes. If you have a positive case, whether it be an employee or a resident in that nursing home, we can test those individuals as well. So, and we've had some that have come to us through their work. We're also been working with some of our local food processing plants, with our chicken plants and things, and they've been sending employees to us. That's been worked out very well, actually. It's given them a great resource to have those 2 sites every week, so that they have somewhere to send them, and then they get results or sending them home or doing the distancing that they need to do based on those results. So that's another reason to continue our consistent schedule for the employers as well.
Now, you are doing the COVID-19 swab. You're not doing the antibody. That is by another agency or company.
That's correct. We are doing the swab or the viral testing.
The twist and shout.
It has been described a couple of different ways, but yes, it is a little uncomfortable. This is I guess you'd say a little more invasive than the flu test. And a lot of us have
Lord.
and the flu test is not fun, but this does need to go a little bit further into your nasal passages in order to make sure that we get a swab so that we get a good test. We've had a handful that came back inconclusive, and most of those patients did come back for further testing, and we were able to do that within a day or two. So we do our best not to have to come back, though.
Just to be straight, Corey, you do or do not have to be basically sent by a doctor to come and be tested.
You don't. We would prefer. We would like for you to have doctor's orders. That way, we can update that physician with your status if you're positive or not. If you do not have a primary care physician, if you don't have insurance, you can still come see us. We'll still go through those criteria. The state health officer set up a system through our assistant health officers and through some of the ones that we contract with, like with TB and others and around the state, to be the providing physician for those persons without insurance or without a primary care physician.
Right.
So again, it's worked very well. We turned down very few people.
Well, you obviously are getting an abundance of tests. You're getting at least the test you need to meet your need.
Definitely. We tested over 100 in Butler County last week. Today was over 80 in Houston. So we're very happy with the results. I think we're getting to the population that needs it, and it's I hope it's often enough to meet the need. We had a physician's office call us just the other day, wanted to kind of tweak the system to get results a little bit faster. So we were able to do that for them and make sure that the system that we're using is getting results to the patient as well as the physician quickly. So I think it's worked very well.
When getting a test, how does one know that they're going to the right place and they're getting a for real deal test? I guess I'm a little worried, Corey, about possible scammers out there, possible misdirection or not official testing, because everyone has to be reported to you so that we can keep track of what's going on, right?
That's right. The private labs do report their results to our office, and those results are what you see, that dashboard that's on our website updating every day, not only with the tests we're doing, but with private labs. Knowing what test to get is, again, if you're not symptomatic and you come to us, we really want you to have some sort of underlying health condition that puts you at a higher risk for complications if you are positive with COVID-19. If you're not symptomatic and you don't have those, it's better probably to talk with your physician about what's right for you. I know a lot of employers are requesting some sort of testing to be able to come back to work for various situations. And that would be a better situation for the physician to help them with. We've had several call and want us to give them some sort of release or something to go back to work, and we haven't done the test for them. We don't know their medical history, and it's impossible for us to do that. It's really better for someone who's been taking care of them for a few months or a few years to give that kind of release or that information. I will say that there is some good information on the CDC website, and you can link to it from our website about the viral testing and then the antibody testing. You can be tested for antibodies and not have them present, and it doesn't mean that you won't get sick next week. Some of the research that I've tried to do over the last few days suggests that not everyone develops antibodies at the same rate. So if you get sick, you recover, you may get antibodies within a week. Someone else may get them within 3 or 4. So it's important, and I tell people a lot of times with other situations with their health care, advocate for yourself. And in this situation, ask a lot of questions. Ask if it's FDA approved, the method that you're using. Ask, are you looking for a general COVID or coronavirus screen? Or are you looking specifically for COVID-19 antibodies? And just do the best you can with that information. Again, talk with your physician if it's someone outside of who you normally see. There is a hotline that you can call on our website if you've got questions, and we would have someone that could sure help you with those questions as well.
That's great to know, Corey. Thank you.
Yes, sir.
I think the question I had for you, Corey, was 10 counties. That's a big region. And I know you hang out in Dothan a lot. Is that your pivot point? Because I see you on the down here when we do the press conferences from the city and the EMA. And so you're around here a lot. But I guess what I'm asking you is traveling and doing these tests. Do they leave from this area to cover those 10 counties?
We do for the most part. This office has, before we became a public health district with 10 counties, we were known as areas, and we had several areas throughout the state. Most of those were anywhere from 6 to 8 counties. When we moved to districts, most of us went from 9 to 10, maybe 11 counties. So this has been known as a district office or an area office, but I also have another office in Coffee County that we refer to as a district office as well. But a lot of our supplies and a lot of things do come to Dothan. I do work from here, but I do try to get to the other counties as often as possible. I recently hired an assistant Kyle Odom, and he's been a wonderful help. Very hard worker, very smart, and he's kind of taken the testing and ran with it, as well as my clinic director, John Cotton. I to support them through the news releases and supplies and those kind of things, keeping that going. I did help them set up today. I try to do that as much as possible, throw in there and give them a helping hand. But it is a little bit of a challenge when we get to Butler and some of those places. That's about a 2.5 hour drive. And we have tents and we have coolers and we have the test and a lot of people that have to go. But it's worked out really well. I mean, like I said, we did over 100 in 3 hours in Butler County. So they've kind of got the setup down to a science. They know what they need. They know where they need it. And they've done it enough times that it's not a guessing game anymore. We've tweaked the setup a little bit in a couple of the sites to give us a little bit more room for the cars to space out, make it safe for us and for the people coming in and out. And it's worked wonderfully. I don't think we could ask for more. I will say this too, though. We've had excellent support from county EMA offices and county EMA directors. When we call and need something, they are on it right away. If we need tables, need chairs, need tents, if we just need help with traffic, they have jumped on it and really been a huge help to us. Houston County is no different. Chris Judah has been wonderful with equipment and help in any way. The sheriff's department, the police department, the mayor, Mark Culver with the county. Really, I don't think we could pull a lot of this off without the help we've had across the
We have some good leadership in the Wiregrass. We sure do.
We do, and they care about where they live and they care about what they're doing, and that makes a big difference.
Well, that leads me to my next question, Corey. In your position, could you kind of give us a report card? How has the Southeast in general responded to this outbreak? And I kind of feel like we did pretty good.
It's funny, we were just talking about that this morning. I think we have done well. I think as far as deaths, we're still a little bit lower than most of the rest of the state. I know there's a lot of initial deaths and a lot of initial cases that were not Alabama related. Southeast Health had a lot from Georgia. They had a huge problem in that southwest corner of Georgia. That seems to have gotten better. I know Southeast Health has said they've got less admissions and they've seen less disease over there. So I think overall we've done well. We've had some problems. We've got a couple of issues now with nursing homes. It's a vulnerable population, and it's I guess you could say it was bound to happen. We were going to get it in our nursing homes, but they've responded well. Again, the EMAs, public health, our unified command in Montgomery have given all the supplies that we can give. The CDC is actually coming in this week and actually visiting several throughout the state. 2 of them in my counties directly, offering assistance with how do you cope with staffing when you have staff sick, personal protective equipment, sanitation, all those things, trying to help those entities deal with this. The National Guard has come in and actually sanitized entire buildings. They have some specialized soldiers that can handle these type of situations, and they've made themselves available. That's been an interesting thing to see happen. I know some of the private companies have come in and done the same thing. So I think they've worked hard at it. But we do have community transmission, and it's a very difficult thing to keep out completely, especially when you may have someone exposed and not show symptoms for up to 5, 10, 14 days before they start to show symptoms. So, but I think overall we responded well. The important thing is, even though we're releasing businesses and we're opening back up, it's important, I think, going forward for everyone to remember that the social distancing, while I know people are tired of hearing it, it goes a long way toward preventing the spread. If you visit someone, not hugging, not kissing them, the shaking the hands is really hard. It's been a couple of times I've caught myself trying to reach out to shake someone's hand in the last couple of weeks because you just grow up that way in the South. But those things can go a long way to helping stop the spread. There's evidence that wearing masks goes a long, long way toward that. And I know that's an uncomfortable thing to do, and it can be a little self-conscious maybe doing that. But it is an important way to protect not so much sometimes yourself, but maybe others, because it knocks down any sneeze or cough or anything that you have, and keeps it from escaping into the air around the other people. Those things are really important going forward. Employers have responded really well. I wish I kept some tick marks of how many businesses I've spoken to the last 3 months. They have tried their best to sanitize and to maintain businesses in a way that keeps people safe, be liberal with some leave policies, try to give those that have been exposed or those that are sick the time that they need to get well. I just spoke with one the other day, and he wasn't sure what to do, and we kind of walked through what the situation was with this employee. Wasn't so much the employee as it was someone at home with the employee that had been exposed. So it wasn't a direct situation for his employee, but he said, you know what? I think I can give them a laptop and they can stay home for a couple of weeks,
Mm.
and they can still work, and we'll just play it safe. So in that regard, I think a lot of businesses have really stepped up. Restaurants, I've seen them wearing the mask, wearing the gloves, and working hard to do it right. And I've tried to spend some money with some of those as much as possible, and maybe even extra little tip, because a lot of them have worked really hard back and forth between the building and the cars. So we need to continue that though through the summer. We need to keep all these things in mind. If we can limit our travel, and I know that's hard to do in the summertime because you want to get out, you want to go to the beach, you want to go to the mountains, you want to go somewhere, enjoy yourself. But limiting travel, and just keeping those things in mind when you visit friends or family, keeping your gatherings small, and thinking about the planning of weddings and funerals and those kind of things, and how do I see the people you love and you want to see, but you keep them safe at the same time.
Sure.
It just
Sure.
takes a little extra planning. I agree, and it makes things a little harder. But
Are there some guidelines
hopefully,
maybe on the ADPH website that people can get that information,
uh,
some good pointers and tips?
there are actually, with the order that the governor put out, the last one, there were several guidelines for businesses, guidelines for close contact services, those kind of things that are all listed on the underneath the banner on our website.
Awesome. Awesome. I know folks are really looking forward to, those backyard barbecues, and they're looking, like you say, they want to get to the lake, they want to get to the beach, and they want to do these things. And Corey, I'm of the opinion, if you follow the rules, practice safe social distancing, when you're out shopping, wear a mask, you know,
Hmm.
and wash your hands a bunch. Um,
It's true. People don't realize how important hand washing is, and I've seen some people using gloves, and I've had a lot of people asking me about gloves in grocery stores. Here's my take on gloves in grocery stores. If you're going to use them, when you get to the grocery store, put them on just before you go in.
mhm.
While you're in there, use them properly. If you tear one, try to have a spare with you. Put them back on. If you can have sanitizer with you, you can wipe the gloves down with the hand sanitizer. When you leave, take them off before you get to your vehicle. Find a garbage can to put them in. We don't want any retailers to have to put up with gloves in their parking lot. And I've seen a little bit of that, but it seems to have gone away, thankfully. But you don't want to put those gloves back in your car. You don't want to handle the steering wheel, the seats, or the groceries. Dispose of them. You can put a bag in your car. You can put a grocery bag, a trash bag or something in the car. You can sanitize them before you take them off, and then take them off and then sanitize your hands, and then make sure you dispose of them properly, but don't bring them back into your vehicle. Um, and hand washing, if you can, before you put them on, after you take them off, is always best. Um, One thing that I've said working with the health department is gloves are only as good as the hands that are wearing them, and that's
Mhm.
probably the best rule I can give
Well, you said that was one method. There are those of us that don't have a lifetime supply of gloves to go shopping. So sanitize when you go in, sanitize before you get in the car, and then wash up real good once you get home. Is that fair?
you. Definitely, don't
Okay.
touch your eyes, don't touch your face, those kind of things while you're in the store for sure.
And it wouldn't hurt to wipe those groceries down as well because they've been obviously handled. So,
Mhm.
That's true, and my wife does that, and I have encouraged others, if you feel the need, if it makes you feel better, and if you think that it's going to help, and I think it certainly is not a bad thing to do. Certainly wipe them down when you get them home, or just before you take them out of the car. Mhm.
that you can't do too much. The little things, like Dave said, that I think is how we've had the impact that we've had thus far. And some say it's a good impact. Some say that we haven't had the results that we'd like to see. But the balance, as you know, and Dave knows, the balance between the life of the economy and the life of the Alabama citizen has to be balanced. And I know we all want to go back, and we want to do it like we used to. And I was reading this morning that the new normal is now simply becoming the normal.
Right.
As you said, the handshaking. I'm like you, Corey. I must say, I actually shook hands this morning. I didn't think, he didn't think, and before you knew it, we were shaking hands, and then we were dashing for the hand sanitizer. So, but it's tough, and those things that we do as human beings, and like you said, as human beings raised in the South, I will miss handshaking a lot, and I'm not much of a chicken winger, and I don't slap feet or any of that stuff, So that'll be a tough one for me, but we got to do it. If we do it, then we're safer. And way back in the beginning, into February, early part of March, my mother was in the medical center and Southeast, and a doctor told me something very interesting, and this was in the early stages before we even grasped what was going on. And he said, just assume that you have it. Assume that you have it, and it will affect everything you do and every way you come in contact with people, and whether it's loved ones or individuals that you meet. You wouldn't want to share it with them. And I have a unique situation. My wife is the manager of a senior center, and they're still at work delivering those Meals on Wheels and things like that to shut-ins. So they're dealing with the elderly. And I have a son who works at one of the nursing homes, and of course he's dealing with that population. So I have to be very careful, because I do not want to have an impact on either one of them that might take it into a different population. So you have to think every minute about what you're doing.
Mm-hmm.
That's true. And that's a good thing for young people to remember, is that, interacting with you, or you interacting with him, and then him going to work, because you never know where somebody works. You never know where their family member works. And another thing is, you never know, the person standing next to you might have just gotten through battling cancer. They may still be battling cancer. Their immune system may be low. They may have, diabetes. They may have heart disease. All those things are putting people at a higher risk. And then depending on age with those things, that increases your risk as well. So when we fight the urge to shake hands, which I hope, one day soon we get back to doing that, because I think that's important. It's an important part of, I guess, who we are in the South. But doing those things and covering our coughs and using our sanitizers and just using common sense with it, it goes a long way to not maybe protecting yourself, but protecting somebody else's family member. And that's, I think, one of the things that you have to remember, especially for young people, because for the most part, although there is some evidence that children are starting to have some reactions to it, for the most part, young people won't have severe illness. Which is a good thing, but we want to protect the other ones that they love and we love.
And I wouldn't want to be the one having to make the decision about schooling, because you got to go back and you got to balance it with the threat level to the younger, the students. That's going to be a tough decision. I know that we can't uneducate our children. We got to get them back in the, and I people trying to do the homeschooling and stuff. Some of them have a lack of proper internet. Some of them simply do not have the skills to educate in all the areas that different age children need to learn in. And it's going to have to be a situation where we go back. But I think for the most part that as long as we still remember those basics, and remember that a COVID-19 swab or test is only as good as this very moment. You could leave that site and then be, in contact with somebody that has it that afternoon. So it would tell you what's happening to you right now, but it ain't going to tell you what's happening to you tomorrow. So just
snapshot. That's right.
That's right. Be very, very careful. And quite frankly, the antibody test, what is that going to show? That may show that you carry the antibody, which means you at one time had it. And we don't truly know yet whether or not that means an immunity to it, how long the immunity might be. So point is the basics. And Corey, let me just say my hat's off to you and your staff over there at the Southeastern District of the Alabama Department of Public Health. We thank you so much for what you guys do, gals, getting out there, setting up those tents, bottled water, PPEs, and just having to deal with that population, a lot of who are in those lines because they are showing symptoms. So the possibility of them having the virus may be high. But thank you so much, and thank you for coming on with us. And if there was one thing or a couple of things you might want to say to the public before we let you go today, you've got it right now.
I guess I would just say be patient, be diligent in what you're doing to protect yourself, protect your family members. We do definitely want to get everyone back to work, and we want to get through this. We want to do it as safe as possible. I would like to say thank you to all the businesses that have called and have asked questions and told us how much they want to do things right and they want to get it right. Thank you to those that have donated some items to us. We've had people donate masks to our employees. We've had water donated by Sam's Club. It's really been interesting to see and nice to see how people have pulled together, and sometimes things happen out of the blue. The support from our cities and towns and our EMAs and firefighters and things all through my district has been great. We don't always have exactly what we need when we need it sometimes, but we seem to always find a way to get it. And the sharing and the communication, I think, has been well. And I'll say, too, that I'm very blessed with the staff that I have. I have some dedicated, very hardworking individuals in all of my counties. They really have worked hard and done it on the road.
Mm-hmm.
Setting up sites, working, and then having to get everything back. And I don't have any complaints from anybody. They're happy to do it, and that makes it much easier to come in every day and do what we're doing. And we're going to continue that as far as I know. Dr. Harris, of course, is our state health officer, and he's monitoring things as we move forward and working with the governor's office. So we'll do our best to update everyone as quick as we can when things change. But for now, if they have questions, please call our health departments and ask about testing schedules or anything else that they need. There's a 1-800 number on our website. It's manned 24/7. There's also an email address there if you'd rather just send an email if you have questions, and someone in our state office will respond to it. So.
All right. Well, Dave, thank you so much for being with us this afternoon. We certainly appreciate it.
Guys, good talking with you, Corey. And it's Alabama. Let me see here. AlabamaPublicHealth.gov.
That's right. Yes, sir.
AlabamaPublicHealth.gov. Y'all have a great day.
Excellent. Thank you, Dave. Thank you, Corey. We certainly appreciate you being here. Folks, thank you so much for tuning in to Wiregrass Strong, the Reboot. We appreciate you being here. We'll do it again next Wednesday at 5 o'clock. And until then, stay strong, Wiregrass. Join us next Wednesday at 5 for Wiregrass Strong, the Reboot, your weekly dose of local COVID-19 related information. Brought to you as a public service of Knights Wrecker Service, with locations in Ashford, Headland, and Dothan. Call Knights Wrecker at 899-3257. Today's Wiregrass Strong, the Reboot, is available for playback on Facebook at B1053 and on YouTube at Wiregrass Radio. Stay strong, Wiregrass.